Hello, I'm Mallory.
I'm Connor.
I'm Avery.
And I'm Kelly.
And our topic today that we will be discussing is over perseveration.
Our presentation is about perseveration. In our video, we will discuss the individuals who are affected, which part of the brain is affected, how to identify perseveration, the different forms as well as the subtypes, and the treatment related to perseveration. ASHA states that perseveration is the act of uncontrolled repetition of a previous production response in an inappropriate setting and occurrence in a place of the correct target word.
Kenneth Rogers from the University of Toronto presented that perseveration is intended the lag or persistence of a mental process. This can mean it can be indirectly manifested in the realm of interference, inhibition, or carryover, which are symptoms of its presence.
Here are some examples of perseveration. First is repeated articulation of the same word or phrase. Next is writing the same word repeatedly, such as have a nice day on a piece of paper. And our last example is repeatedly performing the same action, such as taking your clothes on and off numerous times a day.
In many individuals with aphasia, both fluent and non-fluent, perseveration accounts for many of the errors that we will see. Recurrent perseveration is the most common type of perseveration that we will see in our clients. In many studies, we found that there's a strong indication that severity of perseveration is not significantly correlated with the time post-onset of aphasia, but it is correlated with the aphasia severity. As clinicians, when we are treating clients with aphasia, we will almost always see perseverations. It is our job when treating these clients to identify what type of perseveration the client is presenting. To do this, we will identify which categories that their errors align with. There are three main categories of perseveration errors. This is stuck in set perseveration, continuous perseveration, and recurrent perseveration.
The first common form of perseveration is stuck in set. The textbook defines stuck in set perseveration in an appropriate maintenance of category or framework of the response after introduction of a new task. This type of perseveration category typically occurs on tasks that require changes in response set. This can be extended maintenance of a thought, activity, emotion, problem solving strategies, topics of conversation, and more. An example of stuck in set perseveration is a client continues to list animals when asked to list words beginning with A in a generative naming task.
Continuous perseveration is the inappropriate prolongation or continuation of a behavior without an intervening response or stimulus. So therefore, we can recognize continuous perseveration as the abnormal prolongation of a current activity. And we have a few examples on this slide. Our first example would be a client that added extra loops when writing the letter M or the grapheme M. Continuous perseveration can also be the uncontrolled repetition of an impression or feeling. So, for instance, a client may continue to experience anger or frustration longer than inappropriate for that situation. Our last example is this picture that you see at the bottom, where a patient was asked to produce a drawing of his hand, and he drew an extra finger, so he has 6 fingers on this drawing.
So now we're going to talk about what is recurrent perseveration. According to the Manual of Aphasia and Aphasia Therapy book, recurrent perseveration is the inappropriate recurrence of a previous response following presentation of a new stimulus or giving a different intervening response. So recurrent perseveration is highly common with individuals with aphasia. When treating a client with perseverations, we are most likely going to observe this specific category for perseveration. Some examples for this would be the client names blue for blue and later names blue for red in a confrontation naming task. Another example is the client says "kun" for fun after a naming key. The client reviews the same word or grapheme multiple times for apparent reason.
We just talked about the three most common forms of perseveration. Now we're going to talk about the three subtypes. One of them is semantic perseveration. This is when the words are not semantically related to the target, and it can be immediate or delayed reoccurrence of a word. An example is the first target word is mouth, and the client correctly says mouth. And then the second target word is nose, and the client says mouth again. This is an incorrect response.
Another subtype of perseveration is lexical. These are words that have no obvious semantic relation to the target. The response can be immediate or delayed. An example is if the first target word was apple and the client correctly says apple. The second target word is pear. The client correctly says pear. The third target word is square. The client says apple. This is an incorrect response.
The last one is phonemic carryover. This is when a phonemic is triggered when the target word begins with the same initial sound as the previous response. You can see as an example that the first target word is chair and the client says ready. The second word is key and the client says reek. And then the third target word is glove and the client says rato.
It's important that as clinicians we look to see where their errors fall in the subtypes and in the forms. So a part of our job is to find where they're making these errors and which category they fall in.
The most common areas involved with perseveration include the frontal lobe, parietal lobe, temporal lobe, occipital lobe, and the basal ganglia. These are kind of more general areas because, as we know, the localization of the lesion kind of depends and creates the type of aphasia, and in this case, the type of perseveration.
Some variables listed in the book that influence the rate of perseveration are the nature of the task, the order of the task, the rate of stimulus in the presentations, word frequency, and semantic and phonemic relatedness. So, to go into further detail on each variable, the nature of the task, the definition is stated that perseveration is more likely to occur on non automated tasks. For order of the task, the definition is the closer the nature of the task, the greater of chance for perseverations. For example, labeling cars and bikes. And another example listed in the book is labeling fruits and vegetables. For rate of stimulus presentation, this states that increasing stimulus in a presentation increases the chance for more perseverations. For word frequency, the lower the frequency of the word, the higher the chance for the perseverations. The last variable is semantic and phonemic relatedness. This states the closer of semantic and phonemic properties, the higher chance of perseverations.
There are 5 methods for reducing perseveration. Number 1 is control perseveration inducing variables. This can be done by controlling order and nature of task and word fluency. Number 2 is establish set for new task. This can be done by saying, now we're going to do something else. Number 3 is timeout and distraction. Introducing a short break in the activity can make a distracting comment. Number 4 is raise perseveration behavior to level of awareness. Give the client intention of their perseveration. And number 5 is conceal previous response. Perseveration that appear on pen and paper tasks can be covered up to reduce the imitative response.
As humans, we all experience perseveration at some point. So when a song gets stuck in our head and we're constantly repeating it, we are actually perseverating. But after something like a brain injury, perseveration becomes so much more pronounced and uncontrollable. Perseveration is most commonly seen in a variety of neurological and psychiatric conditions. Some of these are epilepsy, dementia, Parkinson's disease, ADHD, autism, schizophrenia, TBI, and stroke. Perseveration of thought is seen in patients with psychosis or obsessive compulsive disorder. But perseveration of speech is most commonly seen in clients with aphasia, most commonly from a stroke. It was noted in our textbook that perseveration is thought to be an integral part of aphasia.
Treatment for perseveration is designed to bring the patient's level of awareness of their errors and help them produce the correct naming responses instead. So, what this looks like is first you're going to explain the program for treatment to them and give them examples of their current perseverations. Then you're going to establish new sets by offering them a new stimulus word. And then finally, if they keep repeating the same word, you're going to bring awareness to that error. And finally, you're going to want to monitor the presentation for the pace of the stimuli and also allow for 5-second intervals. And on the next slide, I'll give you an example of how you would take data on this. So as I mentioned, the TAP program is designed to increase naming scores and decrease perseverations. So to choose your stimuli, the clinician must prepare 38 stimulus items and record your data by documenting the client's ability to correctly name the stimulus item with or without cues. So on this example that I've attached to the slide, this is a trial-by-trial score form, and you can see they chose 38 items including adjectives, letters, numbers, colors, and body parts, stuff like that. So in this example, the higher the naming score, the better the performance. So you would see on the left-hand side, we have trial 1, and the naming score portion is based on a 5-point scale. So the client could get 4 points if they correctly name the item without a cue, and a 0 if they could not name the object after 3 cues. So you would see the first example was crying, and the client got a 4 because they got that right off the bat with no cues, which is awesome. And for the perseveration score system, a lower score is desired. So on this form, the person scored a 0 on the first try for the perseveration of crying, which is great. And the score system is as follows. So they would receive a 0 if there were no perseverations and a 4 if they perseverated after 3 cues. And you can see on this example that just over 3 sessions, the client's ability to correctly name a stimulus item increased and the number of perseverations decreased, which is what we were looking for. So we see they scored 118 on trial 1 for the naming score portion and a 33 on the perseveration score portion. And by the third session, the client increased their naming abilities by 18 points and decreased their perseveration score by 17 points, which is awesome.
3 common strategies that we can use during treatment as clinicians are to redirect attention of the patient, assist the patient in initiating a new movement or task, and to engage the patient in tasks that involve repetitive action to promote successful task participation. So we attached this article because we thought it had great points to show considerations that we should take in as clinicians. So stress and anger only cause one's perseverations to worsen. So we not only need to teach ourselves, but families and caregivers, friends of the clients that they need to respond in a supportive and calm way when one is perseverating, because showing frustration is only going to worsen the client's perseverations. And as a clinician, it's important that we know, like during treatment, that if the client's perseverating, we need to redirect the topic of conversation. So change the topic. And it's important that we, like, if they get stuck during the conversation, we change to an activity. They get stuck during an activity, we change to conversation. And so this just helps them get out of that repetition of behavior, repetition of speech, repetition of whether it's verbal, nonverbal. This helps redirect the client. So, as with other conditions and disorders that result from brain injury, stress management and being healthy helps manage these symptoms of perseveration. So, as you can see in the article, some of these are sleep well and exercise regularly. Like I said, maintain a healthier diet, either reduce your alcohol intake or just avoid it totally, and learn stress management techniques. Like I discussed earlier, stress can worsen the client's perseveration. So teaching the client stress management techniques will be very beneficial during treatment. And we also need to teach our clients to maintain contact with the people they enjoy, people that are supportive, because this will not only help manage their symptoms of perseverations, but it will also increase their quality of life, which, as a speech path, is our main focus. So, as we've discussed, perseveration is the uncontrollable repetition of one's words or behaviors. As you would think, perseveration can really negatively impact one's quality of life. Some of these negative functional impacts can be in their personal life and their professional life. These can create many negative emotions. It can cause depression, anxiety, maybe even social isolation. But think about it. So, if you weren't able to control your speech or your behaviors and you constantly were repeating words or behaviors that are inappropriate at the time or you didn't want, like, we would also feel these negative things also. So, as a clinician, we need to take into account these negative functional impacts of perseverations that one can experience.
Professionals that work with individuals with perseveration are neuropsychologists, neurologists, and occupational therapists, as well as speech language pathologists.
When going over the topic of perseveration, I found some examples that I thought were really beneficial to show in this PowerPoint about the importance of discussing treatment methods to clients' family and caregivers. This not only can help show awareness of treatment methods, but also it can help increase recovery time with their clients. And the caregivers can also be a big advocate and helping hand in this process of recovery. So on AshaWire, I found this example that I thought was really beneficial to show the importance of discussing therapy methods with the client and caregiver as well. So, for instance, the client sister states, I think I have to take my sister to the heart specialist. In the past weeks, she has behaved a little differently, and I'm worried that she is having problems breathing. When I am having a conversation with her, she has problems speaking. For example, the client gets stuck on a word she has previously produced or perseverates. All of a sudden, she just stops talking and she takes a deep breath. Then, slowly, she starts talking again. This is the therapist's response. No, you do not have to go to the heart specialist with your sister. She doesn't have any problems breathing. Your sister is just following my advice. I told her that when she notices that she is having a problem finding the name of something, or she says a word she has just produced, that she should stop talking and take a long, deep breath. She should take a break and then slowly start all over again. Apparently, she is following my suggestions. The client's sister response is, Oh, I am so relieved to hear that. I was worried about her. Come to think of it, after she takes a deep breath, she usually says the right word or something close to it. So at first, the client's caregiver did not know what the therapist was teaching their client to help reduce the perseveration. So, with the client's caregiver and family knowing the treatment methods that are using outside of the clinic can help reduce the perseverations and increase the recovery time.
On this slide is a picture of our handout, and these are just some of the main takeaways that we want y'all to get from our presentation today. So, in the first box is the definition of perseveration. Perseveration is common in individuals with aphasia, and it is defined as the inappropriate repetition or continuation of an earlier response after a task requirement has changed. There are three universal forms of perseveration that have been recognized, as well as general strategies and treatment methods to reduce it.
And the next section of our handout is the effects. So, as we know, individuals with aphasia are mainly the ones that show signs of perseveration. Perseveration can also be found in traumatic brain injuries and stroke patients. As we know, the lesion that causes perseveration is commonly found in the frontal lobe, the parietal lobe, and the temporal and occipital lobe, as well as the basal ganglia.
Individuals with perseveration usually unintentionally repeat the same word or phrase, write the same word or phrase numerous times, repeatedly perform the same action. There are three common forms. There are stuck in set, continuous, and recurrent perseveration, as well as three subtypes, which are lexical, semantical, and phonemic carryover. The treatment that we talked about is TAP or TAP, is a program that requires general strategies or cues to bring perseveration behavior to patients' level of awareness.
Some facts about perseveration that are stated in the book is that perseveration is known to be one of the most vexing problems clinicians face when they attempt to assess the relative integrity of cognitive linguistic skills of people with aphasia. Because this is a vexing problem, there is a wide variety of professionals that work with these type of clients, which are neuropsychologists, neurologists, occupational therapists, and speech language pathologists. Here is our works cited over our presentation over the topic perseveration. I hope you enjoyed.
Thanks for listening.
1, 2, 3,
Perseveration!